Bonsoir à tous et bienvenue.
Good evening, all. Welcome to our event for the World Day of Kidney Cancer, the advanced showing of the film The Robot. The star of our movie is obviously Dr. Frédéric Pouliot. Good evening, Dr. Pouliot. Good evening, all. Good evening, Mona. So I'll begin by giving a bio for Dr. Pouliot. He's a clinician, a well-known uro-oncologist, full professor at the surgery department of Laval University. He's participated in Canadian research projects as well as international research projects recognized by various funding organizations such as the Health Research Fund of Quebec, the Research Corporation of Cancer, Oncopol, Prostate Cancer Canada, and Movember. Dr. Pouliot has received scholarships from the researcher program for senior clinicians of the Fonds de Recherche en Santé du Québec, as well as the prize for the Rising Star given by Prostate Cancer Canada in Movember. His expertise in genitourinary cancers has been recognized because he was invited as a member of the working group on prostate cancer for the National Cancer Institute in the US, as well as the development group for the genitourinary trials of the Canadian Clinical Trial Group, as well as the executive committee of the Canadian Urology Association. We'd like to add that Dr. Pouliot supports Kidney Cancer Canada. He's a member of our Consultative Medical Council. And Dr. Pouliot has also played an important role to represent Kidney Cancer Canada so that it would be known in the city of Quebec to all urologists and oncologists. He always listens to the voice of the patient and is an advocate for shared decision-making. We're very we recognize that we're very happy and grateful that you're here with us tonight, Dr. Pouliot. Of course, we have already seen the movie and we're delighted of the result. This video will be an excellent and useful tool to all patients and helpers. So without no further ado, we'll present the film and then we'll have the opportunity of speaking with Dr. Pouliot and asking him questions. Kidney Cancer Canada presents The Robot. What is minimally invasive surgery? Well, minimally invasive surgery is a surgery which uses small incisions to penetrate into the patient and also inject CO2 or gas to create room to work. And we go to the organ that needs to be operated thanks to these small incisions and these trocars in which we insert either the kind of arms of the robot or what we call laparoscopic instruments, which look like little rods. Classical surgery normally will make a large incision to have access to all of the organs, whereas with minimally invasive surgery or keyhole surgery, these are these small incisions and trocars which allow us to gain access to the organs. And of course, everything will reduce post-operative pain. What is minimally invasive surgery assisted by a robot? Now, minimally assisted surgery that is robot assisted is very similar to what we'll have with laparoscopy, classical laparoscopy. So we still use trocars, we still use small incisions to insert into the patient. We fill the patient's abdomen with air to create room. The difference is that the robot in these little rods, they're small, very precise instruments that we can manipulate thanks to a console which is outside the patient. And the surgeon can control with far more precision what he will do. Instead of just being rods that move the organs or touch the organs, we'll be able to do many degrees of freedom, put various instruments like pincers, electrocauterizers. So it facilitates surgery for the surgeon. It'll be a lot easier for him to do his work. How is the surgeon assisted by the robot? Well, the robot actually is an instrument. That you have to understand is the robot doesn't actually perform the surgery. It's really the surgeon who's outside the patient on the console And all the gestures of the robot are actually controlled by the surgeon himself. But the fact that the handles of the robot, as well as the degrees of freedom of the instruments, is greatly enhanced compared to traditional laparoscopy, means that really it's robotically assisted to make everything more precise. The other aspect that must not be neglected of the robot is that the vision of the surgeon becomes three-dimension inside the patient, which is not the case with laparoscopy. And this greatly increases the precision of everything that the surgeon will do, because he sees better, because it's in three-dimension instead of only a flat two-dimensional. So the surgeon is kind of emerged inside the patient, so to speak. Robotically assisted surgery, is it a safe technique? Robotically assisted surgery is an absolutely safe and validated tool. What you have to make sure is that these surgeons who use it obviously were trained adequately, because obviously there are particularities with robotically assisted surgery, which is different from a classical surgery, either laparoscopy or fully open surgery. So involved in the surgery, a surgeon, who has experience for these cases that was trained properly. And you also need a team, for example, with nurses and anesthesiologists who have this experience to adapt the standard surgery to the reality of robotically assisted surgery. Are there risks to robotically assisted surgery? Robotically assisted surgery doesn't have any specific risks. Actually, if the surgeon is well trained, if it's appropriate to use this technique for this patient, there's no additional risk to be operated using robotically assisted surgery. But obviously, there's always a risk to any surgery, and the robot doesn't prevent a patient from having a risk when he's operated. But are there additional risks caused by robotically assisted surgery? No, there are no additional risks. It's the same risk of complications that you would have by any other surgery. Is robotic assisted surgery offered to all patients? No, actually, we shouldn't operate all patients with such a technique for robotically assisted surgery. There are many advantages, obviously, to robotically assisted surgery, but also certain disadvantages. For example, if there is a renal mass tumor which is very large, it might be preferable to use a classical approach for surgery to avoid having the cancer being disseminated, or for reasons of security, if there are large um, blood vessels that you need to control during the surgery. So patients must be selected. And even though it's an extremely innovative approach and useful for patients, it's not all patients which are eligible to this surgery. What are the benefits of robotically assisted surgery? The benefits of a robotically assisted surgery are mostly because it's done in a minimally invasive way through laparoscopy. There are no major incisions, less pain after the operation, also less bleeding during the operation. So these are advantages of laparoscopy. Moreover, the fact that the surgeon is helped by the robot, therefore there's more degrees of freedom in his gestures, more precision through the 3D vision. Surgeries can be done in a way that is in a more streamlined way, and more complex surgeries can be done. So that's the advantage, I would say, of robotics, is offering a minimally invasive approach to patients who otherwise would have needed an open classical approach with a large incision. How come robotically assisted surgery can help renal reconstruction after a partial nephrectomy? In the case of a complex kidney surgery, often we talk about partial nephrectomy in such a situation where we remove only the tumor and we penetrate completely into the kidney, where we have to take control of the blood vessels, rebuild the system which collects urine to bring it into the bladder. We have to do sutures, be very precise to obviously avoid damaging the blood vessels, also make sure that there's no leaks. So at that level of precision, robotically assisted surgery is a really superior and can greatly help the surgeon to better rebuild the kidney and therefore avoid complications, hemorrhages, the post-operation bleeding or leaks of urine, which could happen up to 20% of traditional laparoscopic operations for partial nephrectomy. What is the time for recovery for minimally invasive robotic surgery? Well, minimally invasive surgery, either done through laparoscopy or robotically assisted, has one great advantage. For the time needed by the patient to recover after the surgery. We're talking for a radical nephrectomy of roughly 24 hours in the hospital to up to 48 hours, and roughly the same thing for a partial nephrectomy. So if your surgeon offers this option compared to classical surgery, there are undeniably advantages for convalescence. Obviously, when you leave the hospital, there's also a period of recovery at home, which could last between 2 weeks and 3 months to really fully recover the physical strength you had before and also the level of performance you had before the operation. So this period can vary from one individual to the next. What question should I ask my urologist concerning robotically assisted surgery? The first question you need to ask is, what is the experience of the urologist who does this robotically assisted surgery? Is it his first one? Has he had training, what we call a fellowship, or is he at his very beginning? For the patient, it's probably the most important factor, training and experience of your surgeon. Moreover, robotically assisted surgery has many advantages. Obviously, if you have somebody who's well trained and who's able to do it with a lot of experience. Now, the second question I would ask to my urologist before a robotically assisted surgery would be the fact of choosing robotics. Will this bring longer delays to my surgery? That's another aspect. Access to robots in Canada is not always as easy as laparoscopy, classical laparoscopy, or open surgery. So certainly it's a second question you should ask to your physician when they offer various options, amongst others, robotically assisted surgery. How should I prepare myself for the surgery? Well, I think there are two ways of getting prepared. The first thing is to read up and understand what's going to happen and know the advantages, disadvantages, and the possible complications. That's the preparation before making your decision. The second aspect, once you've taken the decision to get the surgery either open or through laparoscopy or by a robotic laparoscopy, you have to try to maintain healthy lifestyles. If you're a smoker, for example, you should stop smoking, and that reduces risks of thrombophlebitis, for example, blood clots in the legs, and also post-operation pneumonia. It also helps healing after the operation. So stopping smoking is the first measure. The second measure, if your surgery is delayed, for example, it's in 6 months, for example, or something like that, if you're overweight, it would be good to eat healthy and to lose 10, 20 pounds. That improves the quality of the surgery ultimately. So if you have time to do this before the surgery, losing weight, it's something you can do also. And also avoid perhaps the use of large quantities of natural products. We don't know all the effects of these natural products, certainly. Some of them increase the risks of bleeding. So if you're a large consumer of these natural products, no, be careful not to have any excesses in that direction.
Alors, j'espère que tout le monde a trouvé ça.
Well, I hope everybody thought it was as good as we think it is. It's going to be an indispensable tool for the Kidney Cancer Society. So thank you once again, Dr. Pouliot, for having participated in this project. I'd just like to take a small moment to thank the videographers, Sylvain and Caroline Renaud, as well as Craig Davis from Podpost, who did the editing. And also mention that you can put your questions in the Q&A tab at the bottom of your Zoom screen. So, Dr. Pouliot, the first question I'd like to ask you is, why did you think it was important to participate in this project? Well, I think it's important to share our knowledge with all patients who are impacted and also the people helping them by kidney cancer or who need to be operated for other reasons. That's not necessarily the cancer of kidney. It could be that they need laparoscopic surgery, either open or robotically assisted. It's important that people who want to know more have the necessary resources. And often, for being a physician who explains things to his patients, you don't necessarily have a lot of time to explain all the details, to answer all the questions here when the patients ask lots of questions. So the initiative of Kidney Cancer Canada is extremely important. And I had to involve myself as a physician to participate in giving this education to the community of patients who will be operated in Canada. Thank you very much for this, Dr. Pouliot. I'd now like to introduce Jacob Lavigne from Minogue Medical. Minogue Medical is a Canadian representative of the Da Vinci robotic systems. Jacob Lavigne is a marketing specialist for the robotic surgical technologies at Minogue Medical. He has a PhD from the research project in surgery at McGill University, where he does research in orthopedics. Sorry. He's also passionate of 3D technology, as well as the management of innovation and marketing practices. He's dedicated his career to facilitate adoption of various technologies and wants to reach these objectives through the development and dissemination of knowledge, the development of partnerships, lobbying, and project management. So welcome, Jacob. Jacob, could you give us a brief overview of robotics in Canada? Oh, absolutely. So thanks once again for the kind introduction. So yes, Minogue has been there since the beginning of robotics in Canada. This started in 2003 with a robot at the Sacré-Cœur Hospital in Montreal. Quickly, we increased the number of robots throughout Canada, and now there are 37 robots distributed in 6 different provinces in Canada. For the time being, there are roughly 200 surgeons roughly who were trained, and over 50,000 operations have been done so far. So we're very proud of this. We're proud of being here today. And thanks to all who have been involved in the production of this little movie. It will certainly an excellent tool for the patients and everybody who is impacted by kidney cancer. Yes, thank you very much, Jacob. Dr. Pouliot, you mentioned that the robot could be used for other minimally invasive surgeries. Could it be used, for example, on metastases to the lungs, for example? Oh, yes, certainly. Jacob is better placed than me to know about all these possibilities, but certainly most of the laparoscopic approaches can be also done with a robot. So thoracoscopy and even cardiac surgeries, the possible avenues for the robot are, well, certainly the same as whatever you can do with laparoscopy, classical laparoscopy. So they're almost unlimited. So I think thoracoscopies could be done by robot, depending on the environment and also the indication of the procedure and also the advantage, because for some surgeries, it's important that the population has to know that there are some surgeries which can be easily done through laparoscopy because they're not complicated. So we have to see the added value of the robot for certain surgeries. It's not always there. So it all depends on the talents of the surgeon, the procedure itself, and the availability of the robot to know whether you should go through a robotic way or differently. And obviously, it frees up the robot if you don't actually need it for a specific operation. Yes, absolutely. And then a tangible example in urology, the specialty we can talk about, removing the kidney completely when you don't need to rebuild the part of the kidney. It's a lot easier to do even using classical laparoscopy than with a robot. So it's a tangible example where when there's an indication and there's a complete nephrectomy, well, But for partial nephrectomy or complex surgery, the robot will certainly have a more precise technical gestures. Oh, I have a question from Christine who asks, recovery from robotic surgery, is it different from recovery from a open or laparoscopic kidney surgery? Open, yes. The incision being bigger for the open surgery, to go work on organs with the classical surgery, you have to put retractors after making a big incision, so you need to make room to work. So all of this causes pain. Obviously, if you have very small incisions that you'll have with laparoscopy. Now for recovery, concerning classical laparoscopy or the robot, there's no real difference between the classical laparoscopic or robotically assisted surgery because both of them require small incisions. So for most surgery, it should be roughly similar, the recovery time. And are there concerns for the tissues that have to heal and their impact on the future surgeries? The scars? No, there's even less impact since the scars are very small. Therefore, you'll have several small scars. But what happens after surgery, when you do a laparoscopic approach, well, the organs, for example, in the abdomen, will come and stick to the inflamed zones of the scar and make additional surgeries harder. They're called adherences. So when you have a very large scar, these adherences will be present over a long surface, so they'll block complete regions of the abdomen. This can make future surgeries harder, whereas after a minimally invasive surgery, these small incisions will cause far less inflammations and far less adherences for the abdominal side, for the abdomen, sorry. So Jacob, you said that there were robots in several provinces, 36 centers throughout Canada, I kind of forgot. And there's a patient that's asking, robotic surgery, is it available everywhere in Canada? And is it accessible for people who live in remote areas? Well, as many other modern cares, it's in centers of expertise, urban expertise centers. So there's often a need to travel to get these treatments. Certainly, there's a growth in the number of robots, and it's something that we're looking at. Obviously, we're focusing a lot on increasing access to the robots. So you need to contact your specialist and ask them, where would be the closest robot, and from them they can refer you. But it's also a good opportunity to mention we have a website called robotassistedsurgery.ca. Well, there are other resources to find robots. So really, I would start by talking to your specialist, and then you can find the resource you need to have access to these treatments. Dr. Pouliot, do you receive patients from remote regions in the province of Quebec to come to get a specifically, oh yes, regularly? It's technology which allows us to do things that couldn't be done otherwise, amongst others, like I said, for prostatic surgery, where we do to treat prostate cancers. We have many people who are referred to us in tertiary centers to have robotic surgery, which also has specific advantages, I would say, for the ease of the surgery, but also which gives a greater possibility for the functions of the patient after the surgery. Also to facilitate the life of the surgeon and potentially improve the life of the patient post-surgery. So yes, we have a lot of referrals for this surgery, especially. Karen is asking, is robotic surgery available in the Atlantic?
On a, je sais qu'on a un robot à
I know there's a robot in Halifax at the Queen Elizabeth II, QE2, but once again, I would talk to your specialist first to make sure it's a good idea and that it's accessible for this individual. What are the follow-up exams that a patient should expect after a surgery, the follow-up tests that a patient should expect following a surgery? Well, it depends on the surgery, obviously, because it's not the surgery itself that tells you which tests you need to pass after the surgery. It's really the nature of the disease. So in the case of a kidney cancer, well, obviously, which interests us here today, well, the test should be normally X-rays or torso CAT scan to see if there are any nodules, and imaging of the kidney, either uh, IMR or MRI, I mean, or CAT scans, and also other tests to follow the function of the kidney, which can be affected by a cancer. Roughly, these three aspects can be done at variable intervals, depending on the nature of the cancer that you are treating. So when we talk about a localized kidney cancer, is there a moment where you just stop doing the follow-up, or is it a permanent follow-up for the rest of your life? Well, most of the people will stop between 5 and 10 years. Once again, it depends on the nature of the cancer, also the clinical guidelines. It could be sometimes after 5 years, but you can also have follow-up up to 10 years, because in certain cases there could be the disease can reappear. So you have to discuss with your neurologist and your physician the aggressiveness of the cancer, and then you can decide on the schedule of follow-ups, normally between 5 and 10 years. We often notice with the patients that they want to go back very quickly to their usual routine, and sometimes too quickly, and this has consequences. But what do patients absolutely have to avoid doing after surgery? And in general, after how much time after the surgery can they go back to their, usual activities? It varies a lot. I would say that it depends a bit on what is your definition of a usual routine. I'll give you an example. For example, young patients are very active, they play sports and their usual routine. We can't resume it in the first weeks after surgery, but most of the people, I think it's safe to resume doing a light physical exercise, after 3 weeks, 1 month, walking right after the surgery. There's no danger. And for work, well, once again, the nature of the work will kind of determine how quickly you can go back to work. Advice I could give to the patient is not to resume too quickly, certainly not before 1 month. There's a physiological stress of being operated, also psychological stress. Often some patients go back to work too early and they will have a kind of chronic fatigue because of this. They won't be able to get rid of this for many months. So at least 1 month, I would say, and sometimes 2 or 3 months, depending on the nature of the work. Yes, we've seen a patient who rebuilt his deck a few weeks after his surgery. Yeah, they can feel very well, with minimally invasive surgery. So 1 month, it could be okay. But I think that work is also, how can I say, an activity upon which patients don't always have the control, especially if they're self-employed and something like that. So often we'll say, oh, I'll start part-time, but it ends up being more than part-time, and this creates problem. So I'm not saying to remain passive. You have to move in a few days after surgery, do physical activities, but to say that you go back to your usual activities that are just as intense, I would recommend to wait at least 1 month and sometimes more. Oh, I think the questions are in English. I'll have to translate them. Do you see robotic surgery becoming used more frequently as more surgical units become available? Well, obviously, it's easier to perform certain surgeries with the robot. So once you see it and that you also observe the quality of the operations you can make with the robotically assisted procedure compared to classical laparoscopy. Well, I think there will be more and more needs in that direction. Now, as I mentioned earlier on, I don't think that all surgeries have to be done with robots. No, really, there are surgeries which can be done very easily with classical laparoscopy, and there are surgeons who are the talent, the aptitude to do classical open surgery with a high quality comparable with what we do and what could be done with the robot. So it's not an answer that's yes or no, but certainly most of the surgeon, if they had unlimited access to a robot, would choose this option for a large majority of their operations. We know that there are many patients who hurt themselves because they went back to work too quickly. Now, robotic surgery, is it different from laparoscopic surgery that's normal or open? Well, technically, no, there shouldn't be a difference in the recovery time for between laparoscopic surgery and the robotic surgery. The incisions are roughly the same size. And hernias can occur for various reasons, sometimes on the tissue of the patient, which can explain partially these hernias. So for this, it doesn't change from one technique to another. So hernias are not more frequent. So this answers all the questions we've received. Is there something you wanted to add, Dr. Pouliot, on everything we've said or seen so far? No, I want to thank you, Mona. I want to thank Mr. Leving for his participation and all the people who were involved, Ms. Collins and Ross also, for having organized this and made possible this educational activity for the patient. So this is all I had to add. And you, Jacob, did you have something to add? Well, just thank you. Thank you for the team, for Kidney Cancer Canada, and Dr. Frédéric Pouliot, who's dedicated to the care and education of the patients. So I think it's very important as an activity. So thank you to all. And it was a wonderful activity. Thank you. Well, thank you, both of you. It was very much appreciated for you to be here. And the webinar will be on our website, and the series of videos will be added to our whole library of videos. And Dr. Pouliot was generous, and if he is generous to answer other questions, which will be added to the video, well, this will help us even more. So thank you once again, and have a good evening. Goodbye.